everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Education and Partnerships at SICA, where we partner with healthcare professionals and clinicians to offer body composition solutions. Today, I'm excited to be joined by Dr. Lindsay Ogle. She's double boarded in family medicine and obesity medicine, and her practice is Missouri Metabolic Health, which we're going to dive into. So, hi, Lindsay.
Hi, Nina. Thank you so much for having me today.
Yeah. Well, I'm excited to talk about your pathway to obesity medicine. And when we were chatting just before, you mentioned that you had done some training with Dr. Carolyn Francavilla Brown, and I'd love to hear more, about you and what got you into this field and how you got here.
Yeah, thank you. I feel so fortunate for, kind of being directed through this pathway to obesity medicine and metabolic health. I knew pretty early on in medical school training that I wanted to choose a specialty that really focused on helping my patients achieve and maintain their health long term, and also choosing a specialty that would help me, establish relationships with patients that I could continue on for years and decades. And that brought me initially to family medicine, which I loved. And I did my training in Denver, and that's where I was able to do an elective with Dr. Carolyn Francavilla. And she really was the one who introduced me to obesity medicine. And I was able to witness her and her practice and everything she was able to do to help her patients, help with their weight maintenance and improve their chronic conditions. And that's where I really saw a lot of patients actually feel better when they went to the doctor's office compared to so many times when we're just helping to, control, symptoms. And so I took that opportunity to really focus on obesity medicine, did some additional training outside of finishing my family medicine residency. Sat for the boards while I was practicing primary care, and then got certified in obesity medicine. And after 2 years of doing primary care in an outpatient setting, I now focus almost fully on obesity medicine and metabolic health through my telehealth clinic, Missouri Metabolic Health.
I love that. And I also love, just how powerful one good provider doing something like that can take such a turn on your career, right?
Absolutely. Yeah, I was just talking about it this weekend, how you never know, an interaction that you have with someone, how it's going to set you down a certain path in life.
100%. Yeah. So another kind of, point that I thought could be interesting for us to talk about a little bit is a lot about language. So I'm big on, the words we use, the way we communicate, images, of course, but a lot about the language we're using. And so I noticed initially when, you talked about your practice, metabolic health is the title, not obesity medicine or obesity care, not weight loss, weight management. And so I know that's probably quite intentional. Thought maybe you could talk a little bit about that, because I think there's so much in the language, and I think we're finally using that to sort of help shape what people understand about the chronic disease of obesity and some of the other conditions as well.
Yeah, absolutely. And like we were talking about earlier, is anyone who is a part of the field of obesity medicine, we know what our goals are, and that is to improve our patients' health and well being, and to do that in the most compassionate and understanding way. And I think that it's really unfortunate that our specialty is called obesity medicine, because I think that it does bring a lot of bias along with it and a lot of misunderstanding. And I think from the outside looking in, it may be easy to assume that our goal is to have everybody reach a quote unquote normal weight or a normal BMI just for the sake of it. And truly, what our goals are is to treat any excess weight that is negatively impacting someone's health. And one of the main aspects of that is relation to metabolic health and leading to metabolic dysfunction. And what do I mean by that? And it can be honestly hard to define what metabolic health or metabolic dysfunction is, but my definition is metabolic health is when your body is able to effectively and healthfully process nutrients and energy or calories in a way that helps you, function well, feel well, and have, energy throughout the day. When that becomes dysfunctional or not optimal is when we start to see symptoms or disease develop. And some of the most common ones are prediabetes, diabetes, PCOS, abnormal cholesterol levels, dyslipidemia, high blood pressure, fatty liver disease. And we start to see those conditions develop when nutrients and energy is not processed effectively in the body.
That's a good definition. Yeah, I think, metabolic health has taken on, I do like it actually as an umbrella term for some of these other conditions because, like you, I think the word obesity has carried so much, ethical and, emotional reactions. And so, I am part of the Obesity Action Coalition, and in that group, we're really serving the patients in a support and advocacy component, and there is always discussion about, is this the right terminology to use? Patient first language, that's another component. We're talking about a person living with obesity, not an obese person. And so I think that really does inch out into all of the ways we're talking about it. I hadn't thought about even the name of the subspecialty or the professional group being, kind of in that realm for this as well. But you're right, it may send that connotation to a patient that, like, this provider's only doing medicine, right? And so what I know about, your profession and the obesity medicine providers that I know is that they are tackling, metabolic health from four pillars, right? From nutrition and movement and lifestyle and medication. And so there is sort of a gap then between what the public hears and what we're doing. That's a really good point. There's a lot of gaps in what the public is hearing, especially in this dialogue and narrative around medications, right?
Absolutely. And I'm so glad you brought up the four pillars. I was thinking the same thing. And that is something that many people are not aware of, is that we have four pillars of obesity medicine, and we're focusing on all of them. So like you said, the nutrition, the physical activity, behavior modification, and then addressing, the medical side, and that could be with medications and or surgery. So it's just one part of what we're doing. It's one of our tools in our toolbox, and we're really focusing on providing that comprehensive care for each of our patients. And I also want to highlight the importance of the individualized treatment plans. Not everybody is going to be a candidate for medication, or may not be appropriate at that time. We are, like I said, individualizing the treatment for each of our patients. And in our training, we've really learned how to do that, rather than having just a one size fits all program for everybody.
Yeah, I think that is really what differentiates the, board certified obesity medicine, clinicians that I know and work with, and that dedication to comprehensive care. So I think, years ago, when there weren't as many medications with significant weight loss as a side effect, a lot of folks could do that on their own. They could tackle nutrition, movement, behavior, all of that, and the medication. But now there's so many more folks who meet criteria for this, significant weight loss, this effective treatment, new generation medications that we have. I am seeing a really nice movement towards, in many programs, getting that comprehensive care done through an interdisciplinary care team with those, professionals who offer that. And I was just this past weekend on a panel talking about scope of practice. So we talked a lot about this, and something one of the panelists said that really stuck with me was sort of that encouragement for each clinician or provider to operate at the um, kind of the highest scope of their practice, their license, and doing he said it much more eloquent than this, but something like, the highest tasks that you can do for your level of care. I butchered it, but I think that's a good point, because again, the person in the group who has the prescribing power and the responsibility to do that, that might be what needs to be done. Whereas registered dietitians like myself, or behavioral therapists, mental health counselors, there's a variety of different professionals that can offer that, as well as in the exercise physiology, fitness professionals. There's a lot of folks there who can help out, and I do love to see that stronger interdisciplinary care team. That's where, in my background with bariatric surgery and metabolic and bariatric surgery, uh, we had gotten there years ago and realized that the surgeon had their place in the care of the patient, but it wasn't in needing to see them so frequently, when the rest of the team could really jump in and operate at the top of their scope too.
Yeah, I love that philosophy, and I think it creates a environment for optimal care for our patients, and also job satisfaction for each of
Right.
us as a part of that team, because we're able to contribute in our maximum capacity to help care for our patients and our community. And I absolutely agree with you there, and I've definitely taken time to network and resource with dietitians and therapists throughout Missouri. So they're not, directly a part of my practice, but I know the people who I trust to refer my patients to, so that they can get that additional care that I am not able to provide at that same level as a registered dietitian or a therapists would be able to provide for my patients.
Well said. Yeah, it's I think there's also our tendency to put things in black and white, all or nothing categories, right? Like, again, even 10 years
Mm-hmm.
ago, when we had programs, they kind of were bucketed. Like, you were either a surgical or a medical practice. It was tough to kind of collaborate together or get patients from one group to the other. But I think a lot of the movement towards virtual care has helped. The understanding of obesity as a chronic relapsing, lifelong condition, maybe that's finally starting to sort of infiltrate these programs. But more and more now, I think patients are being asked to not just advocate for themselves from a access or insurance or financial standpoint, but really advocate for what is that right care team look like. Because there may be a program that you go to and you love the team and they have all the components, and that's a one stop shop. But more and more, there's, some people even have to get uh, medical care or prescription care from someone dictated by their insurance, and then they might have to find a dietitian or a behavioral health provider in another category. And then, where are they going to move? Are they at home? Are they going to a gym? Are they going to a medical kind of fitness facility? I think there's a lot in that's a little bit of a burden back on the patient to try to figure that out. And it's pretty hard when you're trying to figure out who to trust as the patient, because there's so many entrepreneurs in this space these days. So I also really like what you said about, you're finding your network of trusted providers so that you can deliver that to the patient. They don't have to be all under one roof, but the power of a referral from someone that you know and trust and that shares a philosophy is really, I think, critical.
Absolutely, absolutely, because it can be so hard to know, who to trust right away. And it breaks my heart whenever I hear patients, whether they tell me directly after, they've established with me, or I see comments on social media about people who have gone to their doctors for care and have just been treated so inappropriately, whether any symptom that they have, it's blamed on their weight, or weight gets brought up without asking for permission or at an appointment where it has no relevance at. Um, or they're just told to blanket, move more, eat less, and it should be easy. And then, they go home and feel just deflated and defeated, and they feel, well, that's maybe it was their primary care doctor they've had their entire life. They don't know who else to go to. They haven't seen another doctor. And so they feel stuck. Or maybe, they think everybody thinks that way, or maybe that person's right in what they're saying and I'm doing something wrong. So that's always a message that I have, is that if you're getting that response or that interaction with whatever provider that you're seeing, just know that there are compassionate, knowledgeable providers out there, and it is okay to find somebody else to, have that care with.
Totally. Yeah, I think that's a big message, and there's a whole lot that we could talk about in the arena of different types of models that they have now with care. But with the virtual practice that you have, I think I'd like to hear a little bit about how you help with some of those metabolic health concerns, and how do you get them moving and tracking in the right direction, and give me a little bit more about what you're doing in your practice.
Yeah, thank you. So, yeah, so I am 100% virtual. So I can see my patients from the comfort of their own home, or if they have a break at work, which is very convenient. Um, and patients come to me for various reasons. Some people, it is specifically about their weight that has been a struggle for years or decades and are seeking medical assistance. Others may have had a new diagnosis, maybe pre-diabetes or type 2 diabetes, and they're wanting some additional guidance that they haven't been able to get otherwise. So we do, the full history and medical assessment review of any lab work that they've had, and then we really do go over those four pillars. And so I never assume that I know, someone's diet or physical activity level. I always ask, what have they tried in the past? What's worked? What has not worked? And what are they doing now? And get that history. Same thing with physical activity, and then checking for, mental health comorbidities, anxiety, depression, eating disorders, screening for all of those things and addressing those as needed. Um, and then going through, the medical condition evaluation. And then we come up with a plan that works best for that patient. And sometimes we're just focusing initially on making some nutrition changes, or maybe we're going to do some change in the physical activity level. Sometimes it is starting a medication. And then we will, follow up as appropriate after that. Usually I see my patients at least monthly, especially in the beginning, but I don't ever like to go more than every 3 months, which it depends on what area of practice, if that sounds like a lot or not a lot. But I'll tell you from my practice with working in primary care, it's very hard to get your patients in to see you every month because you're so busy with a big patient panel. And so that's one of the reasons why I did want to start my own practice, so I could see my patients more frequently and have a smaller patient panel, so I could be in communication with them even between visits, whether that's them reaching out with any side effects or questions, or if they like to track their food and want to send me food logs, things like that. And we can just have that open communication and dialogue long term.
Yeah. Well, it sounds like it's really helping you get that individual patient focus there at the center. I like, all the language that you're saying, I think is really important. There are little nuances here and there of just, talking about, we're not telling them goals. We're not giving them necessarily advice. We're working with the person to help come up with a plan that works for them based on what they know and like, and what they can do in their environment. So I love hearing that philosophy. And I do think we're in a place where things are changing so rapidly, and the models are changing. But I do know from working with patients who have the disease of obesity at a severe level and who are surgical patients, that it's a long-term relationship. And so the more providers who are in it with that from the start, I think the more, like you said, satisfaction with your job and ability for you to meet the patients where they're at is going to be the outcome. They can tell when it's someone who's just there for the quick prescription and all of that. And people may seek that out right now, trying not to have judgment in any particular area, but that may work for some people. But again, what we know long term is that there needs to be support, there needs to be resources, there needs to be folks from all the different disciplines there, so that if a need arises, you've got that trusted person to help with the nutrition, the movement, the behavioral approach, along with the medication approach, if that's appropriate for the patient.
Yeah, absolutely. And you and I know that really weight maintenance can be the hardest part. And so while you're in the process of, the weight loss portion, if that is your goal, you're building those habits that are going to make you more likely to be successful in the weight maintenance phase. And then continuing to have those regular follow ups. Like I said, I don't usually like going more than 3 months without seeing my patients, because I like to have those touch points, and so we can make sure that we're staying on the right path, or most healthy path for them.
Yeah. And we didn't even get to dive in too much to body composition, but I do know that in a virtual practice, it is a little tougher to figure out exactly how you're going to measure and assess. But I know that that does fit into the model of, we're not just talking about weight loss and weight maintenance for the sake of it. We're talking about, how does that connect? How do those data points with their adiposity and their muscle mass, how do those connect with the other health conditions, the nutrition plan you have them on, how closely you're able to monitor medication dosage, and even talking about the exercise prescription or recommendations for that, based on the person's presentation with their individual body comp.
Yeah, absolutely. And right now, yeah, that's pretty individualized for the person on how they're going to be able to measure that over time. And I do also want to bring up the importance of non-scale victories as well. And so I always like to highlight that with my patients, because they often will just like casually say, "Oh, I'm able to now walk a mile," when before they struggled, walking across the room, as an example. And it may not seem like a big deal to them, or it can be easy to forget where we started when we're on a journey. And I think that that can be a major part of working with somebody who is invested in your progress, because that is something I really like to monitor with my patients and bring them back to and highlight and celebrate along the way.
Oh, I love that. I love that. That was a big focus when I was in the surgical realm. Up front, there was a lot of talk about numbers and goals and ideal, and a lot we can unpack with language. But one of the big things I would always talk to them about up very front was, what is something that you want to do that you can't do right now, and getting to that functional health. And anytime we were stuck in the weeds with the numbers and the scale and all of those conversations, we would come back to, this was really important to you before we even started losing any part of your weight or body composition changes. Where are we at with that now? Well, of course I can do that. And so I think that's really smart to kind of tie back to that, because people want more energy, they want more ability to do the things with the people that they love and all of that. And so there is definitely a place for that in healthcare and in metabolic health. I think that's a big component. So Well, I'm
Yeah,
really glad to hear,
absolutely.
more about your practice and about what you're doing. And I'm hoping that we can connect at some of these meetings that now we'll probably be able to run into each other and see each other at the next meeting.
Yeah, I really look forward to that. That'll be a lot of fun.
So where do we find you if we're in Missouri for patients or if we wanted to connect on social media?
Yeah, so my website is MissouriMetabolicHealth.com. You can learn more about me there and my clinic. I have all of the links to my social media accounts. I'm on TikTok, Instagram, Facebook. I also have a YouTube channel where each week I talk about a different metabolic health or even just preventative health topic. And then I also started listing all of the podcasts that I've been on my website. So you can find links to all of those other podcasts, including this one.
Perfect. Great. Well, it was a pleasure talking with you and look forward to seeing, you a lot more as you dive in and work on everybody's metabolic health. So,
Sounds
thanks,
great. Thank
Lindsay.
you so much.